How effective is regenerative therapy compared to Viagra and Cialis? My name is Dr. Stefan Buntrock. I'm a board-certified urologist based in Germany, and I have more than 8 years of clinical experience using shockwave-based therapies for male sexual dysfunction. In this video, I will compare my real-world treatment outcomes with the efficacy of medications that enhance erectile function, the so-called PDE5 inhibitors. One important point up front: regenerative therapies do not cause systemic side effects. At most, we see mild local effects such as temporary bruising or occasional muscle discomfort during treatment. So let's dive right in. Most of you are familiar with medications like Viagra, Cialis, Levitra, and Standra. Many of you have tried them yourselves. You know what they can do, but the real question is how much they actually do on average. I reviewed the medical literature and analyzed data from clinical trials, and here's the short answer first. In real-world responders, PDE5 inhibitors typically improve erectile function by about 4 to 6 points on the IIEF-5 scale. That is a simplified answer, so let me explain. The IIEF-5, the International Index of Erectile Function with 5 questions, is a short, validated questionnaire widely used in everyday clinical practice. It focuses on functional sexual interaction rather than laboratory performance. The scale consists of 5 questions, each with 5 response options, for a maximum score of 25 points. Normal erectile function is generally defined as a score between 22 and 25. Most large clinical trials, however, use the full erectile function domain on the IIEF, which includes more questions. Where necessary, I translated those effect sizes conservatively into the IIEF-5 range to make the results clinically meaningful and easier to understand. What does this mean for you personally? You can check this yourself. Look up the IIEF-5 questionnaire online, answer the questions honestly, calculate your score, and then add 4 to 6 points. What you will quickly notice is this: PDE5 inhibitors work best when erectile function is only mildly impaired. Once scores fall below about 17 points, it becomes increasingly difficult to regain normal erectile function with medication alone. This explains why PDE5 inhibitors work very well for some men and not at all for others. Roughly 1/3 of men do not respond adequately to these drugs, and response rates are even lower in men with diabetes, severe long-standing erectile dysfunction, or advanced vascular disease. Standra, or Avanafil, tends to show slightly smaller effect sizes, often around 3 to 5 points, although it may have advantages in onset speed and tolerability. So what are regenerative therapies? They aim to restore tissue integrity that has been lost due to aging, vascular disease, or chronic dysfunction. The goal is not a pharmacologic boost, but biological improvement. This includes better smooth muscle function, improved blood flow, and increased tissue responsiveness. In my practice, I use an integrative approach, combining low-intensity shockwave therapy, platelet-rich plasma, and magneto-transduction therapy. Shockwaves have been used in urology for decades, with kidney stone treatment beginning in the early 1980s. Low-intensity shockwaves for erectile dysfunction have been in clinical use since around 2010 and are recommended in the guidelines of the European Association of Urology. They do not currently have FDA approval in the United States, which is why radial pressure wave devices are often used there as a surrogate. Platelet-rich plasma and magneto-transduction are newer approaches and do not yet have guideline recommendations. All my patients complete IIEF-5 questionnaires before and after treatment, allowing objective monitoring of outcomes. In my real-world data, the typical improvement is 3 to 5 points on the IIEF-5 scale. About 20% of patients do not respond, while I have also documented high responders with improvements of up to 8 points. I am very selective when choosing appropriate candidates, which helps keep the failure rate lower than what we commonly see with PDE5 inhibitors. In short, regenerative therapies do not replace PDE5 inhibitors, but in carefully selected patients, they can reset erectile function with an effect size comparable to these medications without the need for continuous drug use. Viagra and Cialis remain powerful tools, but regenerative therapies represent a different therapeutic concept, one that focuses on restoration rather than stimulation, and that distinction matters. Let me be honest with you. There are downsides to this approach. The results can be long-lasting, but patients often have unrealistic expectations. Many believe this is a one-time fix. Biology does not work that way. Even restored erections must follow the same rules as the rest of the body. You do not go to the gym once and stay fit forever. You do not visit the barber once for life. As you continue to age, your penis will age as well. Another important point is speed. Meaningful results typically take 6 to 8 weeks. That is very different from a drug that works within 1 or 2 hours. From an economic standpoint, Viagra and Cialis are significantly cheaper than regenerative therapies. If you are price conscious when it comes to your erection, tablets are the more affordable option. If you prefer a non-pharmacologic approach, regenerative therapies may be an alternative. You have a choice. One final point before starting any therapy: all of my patients begin with Cialis or Viagra. I want to know whether they are responders. In my experience, men who respond to PDE5 inhibitors may also be more likely to benefit from regenerative therapies. Many men have never heard of these treatment options. These videos will give you more details. I'm Dr. Stefan Buntrock, always copied, never matched.